Hello everyone, good evening. I am Dr. Malek Kumar Mishra, the head of emergency department at Yashoda Hospital, Secunderabad. As all of you know, every Friday we bring some new topics that are relevant to our emergency practices, and the topics are very much up to date with our clinical knowledge and education is concerned. So today's topic, what it is assigned is AI, artificial intelligence, and airways, that is new techniques. So how it is gonna be a new game changer in our daily practice? Like we should able to explore how artificial intelligence is transforming our airway management from predicting a difficult airways to AI assisted intubations and simulation based training. So I welcome everyone to have an interactive session on the latest advances in the airway management with AI, artificial intelligence integrations. So all are requested to attend and participate actively. To discuss further, today we have a very renowned speaker, Dr. Santosh Kumar Singh. He is head of the department emergency at Ramakrishna Care Hospital, Raipur. He is also a medical admin head and currently he is serving as a president for SEMI at Chhattisgarh chapter. So over to you, Dr. Santosh.
Thank you, Dr. Mala, for a nice introduction. So today my topic is artificial intelligence and the airway new techniques. So good evening all. Today we are exploring a powerful intersections, artificial intelligence, one of the most disruptive technology of our time, and the airway, one of the most critical aspect of the patient care. So we will look at how AI is no longer concept of the future. It's already influencing airway assessment, decision support, prediction, simulation training, and even emergency response. By the end of this session, I hope you will not only understand where these technologies stand today, but also where they are heading and how they can improve safety, precision, and outcome for both patient and the providers. So what is artificial intelligence? Basically, artificial intelligence is the capability of computer to respond in a manner resembling a human intelligence. So it can also be defined as the artificial intelligence is the development of computer systems that are capable of performing tasks that normally require human intelligence, such as decision making, object detection, solving complex problem, and so on. So why it is important? So difficult intubations occurs in about 5 to 10% of the cases. Failed airway, although rare, but can be catastrophic. Traditional assessment, we used to do a malampatti, grading, thyromental distance are useful, but both often subjective. This is where AI can step in to provide more objective, accurate, and predictive support. So airway prediction, traditional versus AI, traditional tool, malampatti scores, thyromental distance, limitation, accuracy is moderate and best often we miss high risk. But on clinical may classify malampatti as class 2, another may classify at class 3. AI studies have shown these modules are more accurate than the individual's bedside test. So AI can analyze facial and neck fracture automatically. AI provide high risk score not influenced by the human bias. So the principal score to evaluate airway is what we use, that is layman, that is look externally, evaluate 332, malampatti score, obstruction or obesity, neck mobility, malampatti. So these are the things what we used to do. So the other examples of artificial intelligence than application in airway management. So what we used in airway management is machine learning, deep learning, artificial neural networks, big data, and wearable devices. So I'm not going to just explain each definition of each and everything, but I just want to focus on implement outcome of what airways do in outcome of airway management. So used for airway segmentation and predefined image features. Through the measurement of neck circumference and thyrometal distance, it developed a prediction model of the different laryngoscopy. It is a powerful tool to use to analyze the medical image and to provide human visuals more accurate than the laboratory predictors. Models using frontal image of faces and classifying difficult intubation with CAD are used to assess the correct positioning of ET tubes automatically they extract relevant images from airways and segmentation. CNN detect laryngeal adductor reflexes event in laryngeal endoscopy videos. The large amount of frontal images of face used to create AI algorithm. So modern tool designed to detect the changes in resistance and the pressure during intubations, provide real-time feedback to the operator. So it's very important that it's provide a real-time feedback to the operator. So what are the feed in the machine? Age, gender, estimated height and weight, BMI, medical history, previous intubation experiences, inter-incision distances, thyromental distances, Malampati score, upper lip bite test, joint extension, GCS, blood pressure, heart rate, respiratory rate, saturation. So airway volume, airway length, airway diameter, wall thickness, tapping and anatomical. It's the easy mask ventilation basically, and the output given by the machine. So it detects the easy mask ventilation, difficult mask ventilation, easy intubation or difficult intubation. So AI can be applied across the airway journey. I like to think of these 4 stages of prediction, assessment, management, and post-procedure monitoring. So in prediction, before surgery or before going for an intubation, AI can predict who is likely to have a difficult airway. Instead of relying on the Malampati or thyromental distance, AI uses facial photos, neck, measurement, or even imaging data. This allows us to flag high-risk patients earlier than a plan ahead. Assessment, AI can automate the standard airway examination. This removes subjectivity, ensures reproducibility, and saves times in busy ER. During management, during intubation, AI-enabled video laryngoscope can provide live feedback, for example, highlighting the glottic opening or given real-time prompts if view is poor. This could have having a second pair of expert eyes guiding to the emergency physicians. Post-procedure, it's not very helpful, but in our emergency, but sometimes we have to extubate the patient in emergency also. So post-procedure, AI can continue to help even after intubation. For example, monitoring swelling in the airway, predicting risks of collapse after extubation, or alerting clinician if re-intubation is likely. So the list specific tools used in airway management. So these tools enhances the precision, safety, and effectiveness of airway management by the leveraging AI technology. So MaxSlippy, Clapper intubating system, virtual reality, and AI feedback. So we'll talk about MaxSlippy intubating system. So MaxSlippy enhances patient safety in airway management by providing real-time monitoring and support during the procedure. This AI tool ensures that the airway is managed accurately and efficiently, reducing the risk of complication and errors by offering continuous monitoring and immediate feedback. MaxSlippy helps in healthcare professionals make informed decisions, ultimately improving patients' outcome. The Clipper intubating systems is an advanced tool designed to assist in airway management. It includes several key components. This system aims to ensure precise and accurate intubation, reducing the risk of complication and improving patient's outcome. These elements work together to ensure the precise and accurate intubations, reducing the risk of complication and errors. The robotic arm and joysticks provide control and stable movements, while the video laryngoscope offers clear visualization of the airway. The software control systems integrates these components along the real-time monitoring and adjustments during the procedure. So you can see the machine. So it helps during procedure also. So this comprehensive approach ensures correct placement within minimal complication. Ultimately, it's help in improvement of the patient safety. The next is virtual AI feedback. The virtual AI feedback tool is designed to enhance the training in the airway management. So it tracks the hand movement and the success rate, monitors laryngoscope angles, and provide personalized feedback to the trainees. This helps build their confidence before they handle the real cases. Training is a crucial area where AI is transforming airway management ensuring that the trainees are well prepared and confident. So if we are going to compare between Max Sleepy and Clapper in airway safety system, so in summary, while Max Sleepy focuses on providing real-time monitoring and support to the Clapper intubating system, emphasizes precision and control through its advanced component and functionalities. Both tools significantly enhances the patient's safety in airway management, but they do so in different mechanism. So we'll just discuss few cases. Case one, a traditional approach scenario, a 45-year-old male patient with a history of difficult intubation. So traditional assessment, the Mallampati score and the thyromental distance were used to predict the difficulty of intubation. So the outcome was the intubation was challenging, requiring multiple attempts and resulting in minor complications. Now come to the case two. So AI-based approach scenario, a 50-year-old female patient with a similar history of difficult intubation. So AI assessment, the Kepler intubating system was used, providing the real-time monitoring and the precise control during the procedure. Outcome, the intubation was successful on the first attempt with no complication. Now come to the case 3. Again, a 60-year-old male with a patient history of obstructed sleep apnea. What we have applied a traditional assessment, the Mallampati score and thyromental distance were used to predict the difficulty of intubation. Again, the outcome, intubation was difficult, requiring multiple attempts, and reassuring in the minor complications. So AI-based, a 55-year-old female present with a similar history of obstructive sleep apnea, AI assessment, Max Sleepy AI tool was used, providing real-time monitoring and support during the procedure. So outcome, the intubation was successful on first attempt with no complication. So using AI, virtual reality combined with AI feedback, trainers can practice airway management in a safe environment. The system can track fine details such as hand movement, the angle of laryngoscope, and the overall success rate. Based on this, AI provides personalized feedback to the trainee, something even senior instructor may always not capture. So this repeated practice build confidence and prepare them better for real life stake situations. So the challenges, if anything is there, there will be some challenges. AI is powerful, but it comes with the important challenges and the limitation we must acknowledge. So the AI system really rely heavily on the data. If the training data biased, incomplete, or of poor quality, the output can be misleading. For example, AI trained mostly on data from one region may fail to perform accurately in another. Privacy and the patient consent are the critical. Large amount of sensitive patient information are used to train AI system. Without strict data protection measures, there is a risk of breaching the confidentiality. Many AI models are not validated across diverse populations. What works for one demographic group may not work for another, which can lead to inequities in healthcare. The accuracy and reliability of AI not guaranteed. Even high-performing model can make errors, and in healthcare, even a small mistakes can have a serious consequences. So finally, AI adaptation requires regulations, guideline, and the continuous validation. We cannot simply build an AI tool and assume it will remain reliable. Ongoing monitoring, audits, human oversights are essential to ensure safety. So there are few studies, the techniques used for AI and the DL model offers promise in difficult airway management. What is next needed? A large multi-centric trial focused on the best available technology and prelude to including these clinical pathways, especially those patients undergoing urgent intubations. NAC MG could have their degree of difficulty intubation predicted based on the data already available, and assessing the against actual outcome would be insightful. A combined approach with the image and the clinical assessment. So one more study in BMJ Open, that is this study aimed to formulate a protocol for a systemic review and meta-analysis to ascertain the diagnostic value of AI in difficult airways. It also presented up-to-date evidence regarding the diagnostic efficacy of AI algorithm and identified difficult airway. It summarized evidence regarding the competence of AI algorithm and identified difficult airway. If AI algorithm exhibit clinically significant diagnostic values, the evidence obtained from the meta-analysis could be improved clinical airway management. So one more from the algorithm of Airway, applying artificial intelligence to enhance airway assessment, management, and training. This is again, so the most of the studies, I have gone through multiple studies. Unfortunately, there is no studies are still for emergency, but all the studies are done in anesthesia department for plant patients. So this is the AI and airway algorithm. So advantages: remote substitute medical care, personalized treatment management, reduce medical resources waste, real-time decision support, enhances training effectiveness and experience. Disadvantage: what I have just explained: data dependency and data privacy, high maintenance and development cost, lack of ethical reasoning, ambiguity in legal responsibility, who will take the responsibility, machine or a doctor, and the black box effect. So in one more studies, these reviews cover the current capabilities of robot and AI tracheal intubations. So providing new insights that advocate for the border of adaptation of these technologies to improve airway management. Literature's review on robotics and AI was conducted through a searches of PubMed, Web of Sciences, and IEEE Explorer database in February 2025. Drawing on classifications framework derived from the experts' opinion and existing literatures, these studies are categorized into 6 key stages. Most of these technologies remain in the testing and validation phases, with only a few having reached commercializations. So the future of AI and human collaboration in airway management. So it emphasizes a synergistic partnership where AI enhances the doctor decision making rather than the replacing them. So this collaboration aim to improve safety and precision in airway management through the several keys area. The vision aim to create a safer and more efficient airway management process by leveraging the strength of both AI and human expertise. So there should be a collaboration. We can't totally dependent on AI. So how AI support the clinical judgment? AI support clinical judgment in airway management by providing objectives, accurate and predictive assessments. So this support helps address challenges such as difficult intubation and failed airway cases. AI aids in various aspects of airway management, including assessment, prediction, device selection, real-time monitoring, and the post-procedure outcome analysis. By offering real-time insights and reducing human bias, AI enhances the safety and precision of airway management. Ultimately, guiding doctors is making informed decisions. So step-by-step explanation, deep learning segmentation workflow. So detector AI system identifies the key structure, that is airway, ET tube, vocal cords. Example, detecting whether the tube is in the trachea or esophagus. Now, second is correction. So human experts, radiologists, emergency physicians, intensivists, or anesthesiologists check and correct AI mistakes, ensure accuracy, and prevents false results. Third one is quality control. So data is reviewed to maintain high standard, that is bad or unclear images or wrong labels are filtered out. Fourth one is the label data, that is gold standard data, images with the correct marking, trachea, cords, ET2 position is stored. This is the foundation of training of AI. Now, deep learning training, the label data is used to teach the AI model. AI learns to automatically recognize the segment airway structures. So this is the flow chart. This is the circle which we use to deep learning segmentation of workflow. So it's develop a safer and more efficient method for airway. So it's a provide a visualization, clear airway view for guiding precision, accurate attitude placement. Automations is assist in handling tube handling and navigation stability navigations. So stability reduces the human error and ensure consistency. Output stages right side, the result is precise, rapid and safe tracheal intubations, minimizing complication and improving patient safety. So the key message of this diagram highlights how AI and robot tool can make airway management safer, faster and more reliable by improving visualization, precision and stability during intubation. So the future of AI and human collaboration in airway management emphasizes a synergistic partnership for AI and the doctor's decision making there rather than replacing them. This collaboration aims to improve safety and precision of airway management through several key areas that integrated across all steps, robotic airway devices, advanced training simulators, and human AI collaborations. So the vision aimed to create a safer and more efficient airway management process by the leveraging the strength of both AI and human expertise. Now come to the ethics and medical legal aspects. When we talk about ethics and medical legal aspects, there are some very important issues. First one is accountability. If AI mispredicts, say misses a diagnosis or give a wrong treatment suggestion, who is the responsible? Is it the doctor using it, the hospital, or the AI company? This is not clearly defined yet, and that makes it risky. Come to the second point, patient consent. The patient should have a say in whether their personal data is being used in train or run AI models. Without clear informed consent, we risk breaking ethical and legal boundaries. Now, we need a proper legal and regulatory framework. Just like medicines and devices go through a clinical trials and approvals, AI should also have a standard certifications and the periodic monitoring before it's widely used. AI should always remain a supportive assistant, a decision support system. The final responsibility and the judgment should lie with the doctor, not with the machine. So clinical evaluation and traditional scores associated AI led to hybrid decision making, which is more than the simple sum of two components. So 1 plus 1 is equal to 3. So clinical evaluation and traditional score plus artificial intelligence, that makes the hybrid decision making model. So this is the video just I want to share. It's a simulation lab. So how it works, how AI is going to.
There is no sound, I guess. There is no sound.
So just we can imagine how AI is going to be installed and what AI can do. So probably we are sitting somewhere else and we are intubating the patient with the help of what right now the robotic surgeon used to do. They used to do the surgery by sitting in a console and with the forehand, without with the help of robot, with the forehand they are operating their patients. So now probably this will come very soon, where we are going to get a good machine which are going to help us to save the time for intubation and taking care of the patient airway. Thank you.
So this is gonna be the future.
Yes.
Basically, thanks to you, you have wonderfully explained. I think for every emergency physicians, they need to be alarmed because in due course of time, maybe after 10 years or 15 years down the line, this is gonna be as practically we are doing these days, video laryngoscopy, bronchoscope guided intubations. After 10 years, this will be a routine practice. And this is the future. So, thanks to you, you have explained in a very detailed way. So, I have certain questions for you, like two very important aspects to our emergency department is concerned. Can you just again explain about discuss the ethical and medical legal aspects or implications of
So,
AI assisted airway,
yeah.
and who will be blamed if something goes wrong? Is it the AI will be blamed or the doctor who is making the decisions, sitting very far behind some other areas? If something goes wrong with the patient, who will be blamed?
So obviously the doctor, no doubt about that. We are the softest target. So the doctors are the first responsible guy who is going to take a blame. So basically ethical, because we have to no idea what we are doing ethically, because right now the surgeons are doing surgeries with the robot, with the help
Yes.
of robot.
Yes.
So they have gone through multiple things, multiple ethical clearance, and everybody now patient is giving consent to do. The first question they used to ask, कि, sir, ये surgery, who will do that this surgery, robot or you, sir? So you have to make them confident that this surgery is done by, this procedure is done by a doctor, but with the help of the robot.
Robot.
So what robot is doing in surgery? They are basically, doctors use their two hands, robot use four hands. So just he had to scroll the joystick and do the surgery. Second thing is that consent is a big concern, because what we have to do, we have to feed the data of each and every patient to the system. So it's a big challenge. So are they are ready for that? Yes or no? So by coming days, probably they will accept it and they will allow it and they will sign just like a surgery. They accepted it. We are doing lots of surgery with the help of the robot. So we are doing knee replacement. We are doing general surgeries from the robot. So probably when this will come, people will accept and this will be done by us also.
Yeah, that's good. Wonderfully explained. So, can AI-based monitoring system help us in diagnosing the peri-intubation hypoxic cardiac arrest particularly? Can AI-based like monitoring system will help us?
So at present, I have gone through multiple papers. So at present, we have no idea at all, just because I have gone through the airway. So just they predicted the difficult airway, and if that is, I have no idea about that.
Yeah,
Sorry.
basically what it is showing is AI can predict, analyze that waveform, capnography, and
Yeah.
oxygen saturation trends.
Yeah.
So, and hemodynamic data to predict whether it is a impending deteriorations, so that the AI can give us early alerts, and so that the doctor who is treating, they can get a alarm system. Early alerts can help us timely interventions and reducing this peri-arrest, basically physiological difficulty airway. We can take care
Yes.
of very carefully and we can address that issues so that we can avoid cardiac arrest during the intubations or during immediately post intubations phase.
Yeah.
So, one last questions. how can predictive analytics using this AI, artificial intelligence, improve our triage decisions in patients at the risk of airway compromises? Like
So
how can
basic,
predictive analytics using this AI model to improve our triage decisions?
Dr. Malay, till now, the AI predictive decision, the studies, what studies have been done, that was done in the OT room.
OT rooms, yes.
In OT room where there is a plant cases. None of the studies are in the emergency room,
Yes, yes,
where we are in the ICUs, where we are going to do a crash intubation of the patient. We are sitting in a room and all of a sudden a crash patient used to come in our department and we
yes,
have to intubate that patient.
yes,
So
yes.
none of studies have been done till now.
Mhm.
So we have to look further studies for that. Then we can comment on that.
Okay. All right. Sounds promising. So, one more thing, like, can identify the current challenges in implementing this AI technology for airway management in the resource limited emergency setting. Like, take an example of district headquarter hospitals. So they will be having so many challenges like lack of infrastructure, lack of data integrations, data privacy, all these things will come into picture. So how the AI is going to take up that challenges?
So what we are doing. So AI, I'm not just deviating from bit of the topic. What AI used to do right now. So just we click a picture of X-ray. One day, one patient is clicking a X-ray, and he just put that X-ray in that chat GPT, and he got the result of that X-ray. Same way they are doing for ECG. Same way, if we used to do some during counseling a medical term, just they note it down and just they put it down in the chat GPT. They are getting the results of the that questions and that medical term, and they are asking a leading question from us. So obviously, this is going to be help us a lot. Obviously, cost is a issue that will come, and the training and everything what I have told in my during presentation,
Yes,
training,
yes,
studies, and accountability. Obviously, who will take the accountability of that? Second thing, cost is a major issue because the limited resources are now in our peripheries emergencies. There is a very bit of concept of emergency in periphery where just emergency is working like a traffic police system. So that is now the days going changing on. Most of the emergency are well equipped right now, and the emergency physician are doing good jobs stabilizing patient. It's not like that if a bad patient come, they used to send to the ICU to stabilize the patient. So obviously, we started the emergency. We never thought emergencies were going to work like this. At present, we are doing whatever required for a patient. We are treating that patient. We are making diagnosis of that patient. So probably AI will come and it will help us a lot.
good, good. Okay, with all this, is there any more questions from the chat box? Would be like to answer and ask Dr. Santosh? And moreover, in these days, as you have mentioned clearly, these people are uploading these CCGs or ultrasound reports to the chat GPT and they're getting answers. Like in one way, AI enhance this ultrasound. Basically, it is giving us a like exact structure. Like suppose take an example of airway, cricothyroid membrane, where it is, what is the trachea and esophagus, guiding this. Suppose someone is requiring for surgical cricothyrotomy, it
Yeah,
can guide us in a precise manner, confirming the tube positioning. And this image recognition tools are, I think, these days it is going to be a real changer, game changer, because many of the times it will be difficult for as a human interface to go and to do the surgical cricothyrotomy in a crisis conditions, not in a routinely environment. I'm talking
yeah.
about this emergency settings. So definitely, yes, the AI integrated tools, this reading this ultrasound imaging tools, there will be definitely improvement of identification of airways anatomies during these emergency situations. Okay, so I don't think any other questions are there in the chat box. So once again, thank you so much for the elaborative discussion on artificial intelligence and new ARV techniques, which are going to witness in next, I think maybe down the line 5 years or 10 years ahead.
No
So
idea.
thank you once again, and
Thank
thank
you.
you, Sudha Hostel, for the opportunity to share our knowledge. Thank you so much.
Thank you, Dr. Mala. Thank you.
Thank you.